So there are some limitations of life cycle assessment. While it's generally incredibly useful, it doesn't always account for the kind of system limit. So one example is the New Zealand dairy industry, where they drove efficiency per unit of product, but actually that reduced costs of production, which in turn increased production. So the absolute impact of the industry was actually increased overall. It could also lead to substitution hierarchies that might actually shift problems or make problems worse. So for example, shifting from beef to chicken increases the number of farmed animals in the system, which could increase the requirements for antibiotics and also feed. And it also misses hard to measure impacts or hard to quantify impacts like biodiversity loss, for example. Next slide, please. So system approaches look at the whole system and ask what's actually possible within those planetary boundaries or geobiophysical thresholds, and actually seeks to apportion them in some way across society. Next slide, please. So one example from the literature where that was conducted, I just want to draw attention to that final row there in green along the bottom. So essentially this was the only combination of dietary shift to flexitarian and technological innovation with agricultural production and a reduction in food waste that actually was within those constraints of the 5 planetary boundaries used in this analysis. Next slide, please. And while planetary boundaries is an incredibly useful concept and that analysis itself was incredibly useful, there are some limitations with using the planetary boundaries in their current form, in that they're not necessarily robustly estimated in terms of the 1.5 degrees limit, for example, and all of land use by agriculture. And they're not necessarily easily downscalable to local boundaries. They can miss some hard to measure impacts like biodiversity. And also there are governance issues in terms of like who actually decides to translate those global limits down to local consumption. Next slide, please. So finally, just to wrap up, next slide, please. There is no simple solution, unfortunately. We don't just have a simple answer to this. There are really useful measures or techniques out there, such as LCA and the systems approach or planetary boundaries. They can have some issues and trade-offs, but really it's absolutely clear that we need to describe what better diets actually look like to reduce their environmental impact. Next slide, please. So environmental pressures alone are really necessitating food system transformation. Business as usual isn't an option for any sector of the economy going forward. And actually in the food system, this would increase land conversions and increase greenhouse gas emissions under a business as usual scenario. In contrast, if we actually start to shift diets, this could actually free up plenty of land to help achieve those carbon dioxide reduction goals that we talked about earlier. So for example, here shifting to fully plant-based diet would remove the equivalent of 16 years of CO2 emissions from the atmosphere, which is around 2/3 of the amount that we need to align with 1.5 degrees. Next slide, please. So dietary change is really key for health, biodiversity and climate, along with a whole range of co-benefits. And relative to today's diet, a healthy diet is also a more sustainable one that is diverse, rich in plants and whole grains, lower in meat and processed products as well. And final slide, please. So rather than us identifying a kind of one-size-fits-all dietary pattern, what we're actually looking at is some candidate rules of thumb for how to actually think about dietary shifts and consumption within the context of dietary guidelines. So we're using a best available foods approach, and that is essentially looking at limiting consumption to sufficient, increasing whole foods and decreasing processed foods, aiming for a diverse range of fruits and vegetables and predominantly plant-based diets. And of course, production techniques actually do matter. So where possible, source from agroecological farming techniques. And that is all from me. Thanks very much.
Thank you so much, Helen. And you managed to keep within the time limit. You're saying a lot in a short period of time, but as we've heard, we need to establish criteria for measuring the sustainability and environmental sustainability of our diets, just as we need to measure nutrient intake, for example. This is going to be a really important step in transforming food systems. But how do we move beyond the establishment of criteria and move towards real on-the-ground change? How do we get a population to eat according to the new dietary recommendations and guidelines? So Dr. Amanda Wood is going to walk us through some of the approaches, just some, that we can take to implement these recommendations and guidelines. I'm going to hand the floor over to you, Amanda, for your presentation. Thanks so much.
Thanks, Afton. And if I could just have my slides up. And just to say thanks to the Nordic Council of Ministers for inviting me to talk about how we can get the most impact out of the Nordic nutrition recommendations in NR, now that they will incorporate both sustainability and health. So if we can just get my slides back. And go to the next slide. So our task over the coming years is going to be bringing to life the NNR and the dietary guidelines that they underpin, and seeing those wonderful recommendations reflected in all of these places where we eat and make decisions about food. So at home, at the grocery store, and when we eat out, either for a quick bite or a more leisurely meal. Next slide, please. And there's some good news that's going to make this task a bit easier in the Nordics, because there have been some wonderful tools and initiatives created in the region to bring the NNR to life. So you'll hear from speakers later to discuss things like school meal programs, labeling systems, and national food-based dietary guidelines. So these initiatives are the tools already in the toolbox of the governments in the Nordics, and they've no doubt made it easier for individuals to eat more sustainably and healthier in the region. So if you want an overview of all of the public sector initiatives that have been developed in the Nordics, you can check out the solutions menu, a report produced by the Nordic Council of Ministers, linked on the screen, but I'm not sure if actually you can see that, so maybe we can put that up. Next slide, please. But our challenge is that these initiatives have not been enough alone to see the scale of change that we need. So for example, we know that many people across the Nordics aren't following the national dietary guidelines we already have, but are instead eating lots of foods high in saturated fat, added sugar, or salt, eating more red and processed meat than recommended, and lacking in fruits, vegetables, pulses, nuts, and seafood, or all of the healthy things. So these unhealthy diets place a big burden on our health and represent one of the leading risk factors for poor health and mortality across the Nordics. Next slide, please. We also know that these diets are coming at a cost to environmental health. So for example, the Swedish diets exceed the sustainable per capita threshold for several indicators of environmental sustainability, including greenhouse gas emissions, cropland use, nutrient application, and extinction rate, as you can see on this figure to the right. So here, that smaller red ring indicates a sustainable threshold of impact. So all of those red radials outside of the ring indicate an increasing risk for the environment. So while there are differences in eating patterns across the Nordics, we expect this overall picture of environmental impact from diets that we see in the Swedish diet to be broadly similar across the Nordics. Next slide, please. So if we want to strengthen and complement the initiatives already in place to go that next step, what can we do? So I want to talk about 3 different approaches that have already taken root in the Nordics, some with longer histories than others, that can continue to guide action in the region as well as be used in other countries. And the first is to think outside of this grocery bag, box, or basket if we want to increase the reach of the new recommendations. So in other words, we need to be looking beyond the immediate environment of the individual and take a systems approach. So next slide, please. Next slide, please. So yes, we can and should be targeting this more immediate environment by, for example, changing the way we advertise food or changing the way we educate about food. So these types of initiatives are important foundations of knowledge. Next slide, please. But we also need to zoom out and see that there are all of these other factors beyond the media environment that influence what a person eats. So for example, what type of food is produced? How does it get transformed as it moves along the value chain? And then where does it end up? So one study really drove home this point when they looked at food-based dietary guidelines around the world, not just in the Nordics, and then looked at food supply. And they found that in general, with lots of regional variation, the food supplies were not aligned with the national and international food-based dietary guidelines. So we can't expect people to adopt sustainable diets when what they see in the store, the restaurant, contradicts what they're seeing in the guidelines. Again, this highlights the importance of this systems approach by identifying, supporting, and scaling solutions all across the food system, because ultimately those solutions are going to make it easier for the individual to make the more sustainable choice. So let me underscore that this isn't an either-or situation. We don't need either initiatives aimed at the individual or at the broader food system, but we need a package of initiatives that all complement and reinforce each other. Next slide, please. So the second approach goes hand in hand with the first, and this is to take an all hands on deck approach, meaning focus on inclusive engagement. So because we're dealing with food systems, that means everyone is shaping the system in one way or the other. So governments have a key role in creating sustainable food policy, public policy, as I mentioned with some of the previous initiatives. But there are a lot of others who can support and amplify the impact of those initiatives. So this slide just shows a few examples of who we can and should be engaging. So the key to this all hands on deck or inclusive engagement approach is seeing how each of these groups can draw on their unique strengths and influence to make a positive change in the food system. Next slide, please. The third approach then really brings together systems thinking and inclusive engagement, and this is taking a mission-based approach. So think of that moonshot mission, but now societal missions instead of the more technical moonshot missions have been made popular at the EU level and are being trialed in the Nordics. So what is this approach? It's to tackle grand challenges like climate change, hunger, or inequality. We need to define missions, and these have a clear, measurable, time-bound, but very ambitious target. So these missions aren't achieved through one big project, but rather through a diverse and linked portfolio of experiments here shown as mission projects. So some experiments will fail and others will succeed. But the idea is that they're all aiming towards the same mission goal, and that these experiments are engaging a wide range of actors from all parts of the food system. Next slide, please. Just quickly for a more tangible example framed in the Nordic context, to address some of these big challenges, we can use the entry points of, say, changing our diets and meals. The specific mission could then be to ensure that by 2025, time-bound, all public meals consumed in the Nordics are sustainable and tasty. Then a range of smaller experiments here called demonstrators could work to see how policymakers, producers, distributors, food service outlets, and so forth can make changes that help reach that goal. Next slide, please. So to sum up, to succeed in our task of bringing the NNR and the National Dietary Guidelines to life, we need to look at connections. So connections all across the food system, connecting change makers with the guidelines, and connecting all of our initiatives back to the individual in an effort to make the most sustainable option the easiest option in their everyday environment. Thanks.
Thank you very much, Amanda. And now I want to turn to you, the participants in this webinar, to hear the questions that you've been asking and to pose these questions to the three speakers that you've just heard from. So first of all, I've been gathering in these different questions, and unfortunately we won't have time for all of them, but I'm going to start off and give an opportunity to each of the three speakers. I'm going to pose one question to each of them, and if we have time, we'll go for another round. So first of all, the question is to Rune. Why are meat substitutes and plant-based drinks, for instance, not included in the analysis?
I think at this point we focus on foods and diet and not supplements. So everything that could be considered as a regular diet and not as supplements will be included in these food-based dietary guidelines.
Thank you very much, Rune. So the next question is to Helen. So how does NNR account for the shortcomings of life cycle assessment? Some were mentioned, but from a Nordic perspective, grazing nutrients actually, grazing ruminants actually are necessary to maintain the biodiversity of landscapes and for several ecosystem services. How would you respond to that?
Thank you. Yeah, great question. And it's definitely something that we're still unpacking. So I don't have a full answer to that right now. You'll have to wait a little bit longer until we've actually gone through those processes and devised the analyses. But essentially what we're looking at is the rules of thumb that I mentioned in my presentation, and then really trying to put them within the context of the Nordic region. And those issues mentioned there are exactly the sort of issues that we will be looking at. And that's really the sort of the uniqueness of this approach, that we're taking the kind of existing evidence and then really trying to unpack what that means for the Nordic region.
Thank you, Helen. Amanda, this is a question for you. Can you comment on the relationship between the keyhole label and the EcoScore labeling that's coming out of France right now and also spreading to other parts of Europe? And can you comment on that as a potential labeling initiative within Farm to Fork?
Yes, I'm actually not an expert in the labeling initiatives and can't comment too much about those because I don't know about them in detail, but I know that there's probably others on this call that are much more knowledgeable about those programs.
Helen or Rune, would you feel comfortable answering that question? It was directed to Amanda, but you can pick up on it. I think you're on mute there, Rune.
Not really. I think there are so many issues related to the labeling business, and there are so many conflicting issues from the different health authorities and nations. So I think at this point, I think it's hard to respond to that. It's of course something that is deeply looked into.
Okay, thank you. So Rune, back to you. Have you considered ultra processed foods in your recommendations? And then the follow-up question to that would be, now I'm combining two questions together, but they're related. The follow-up question is, how would you actually define ultra processed foods if you are looking at that?
So that's a good question. How do we define ultra processed foods? And that is exactly what we are looking into now. We are working on the chapter on ultra processed foods, and we are not certain how fruitful the concept of ultra processed foods will be for us, but we will look into it, and we will try to see whether we can develop a definition. We can follow a definition and see how useful it will be for the food-based dietary guidelines. So it's too early to say. We are in the midst of that process exactly right now.
Thanks very much. And Helen, over to you now for the next question. Are you accounting for technological evolution in the food system or in food systems that is limiting the greenhouse gas emissions as we see today? So I guess kind of looking forward for change within the coming years, is that being accounted for?
Yeah, it certainly is in the analysis that I've been involved in previously that I presented in my presentation, and also in the planetary boundaries work that I presented as well. They accounted for technological improvements to chemical application, for example, which would in turn reduce the use of those chemicals and in turn reduce the associated greenhouse gas emissions. So in many of the life cycle, sorry, not the life cycle, but the assessments that go forward up to 2050, for example, do take into account those technological improvements that in turn deliver greenhouse gas reductions. In terms of the Nordic, this specific analysis that we're conducting for the NNR, I'm not entirely sure how far forward we will look and whether we will actually be conducting those kind of detailed analyses ourselves. I think the plan mainly is to use the existing evidence and synthesize that. So in that process, some of that will already be there because it's already in some of the existing evidence itself.
Thank you. So the next question is for Amanda. So in terms of stakeholder groups that you think should be more involved in the processes of basically transforming diets and food systems, are there any specific stakeholder groups that you've identified throughout your research that are kind of being that are being evolved to a very limited extent, or that could be involved more in the transition?
Yeah, thanks, Efton. Absolutely, there are so many groups. I think if you look back on my slides, for example, some of the big businesses are often engaged quite a bit, but some of the smaller groups or startups, the tech community is just flourishing. But also thinking about things like artists, storytellers, educators. I know there's a lot of movement here with medical education, so healthcare professionals. Really, as I said, everyone shapes the food system in some way. And so everyone has their own unique power to make that a more sustainable food system. So the challenge really is trying to bring all of those different groups together. Yep.
Thank you very much. And so Rune, over to you. Amanda, she mentioned in her presentation that saturated fats mentioned saturated fats as a factor of a poor diet. Is a nuanced approach to saturated fats in the NNR being discussed in this edition, since all saturated fats are not equal with respect to health outcomes?
I understand that people are asking those type of questions, but I think I would like to comment on this at this point because we are considering all these health issues questions right now, all up until December 2022. So of course we are looking carefully into all sorts of evidence, both molecular basic types of evidence, clinical evidence, epidemiology, and try to do our best in the full scope of lines of evidence regarding different qualities of fat. But I would not like at this point, it's too early, we are in the midst of the process of considering the health effect of a variety of fats and fat-containing foods.
Thanks, Rune. So Helen, another question for you. Do you think that we can be more ambitious on the change in terms of change instead of making it soft change? Why not moving in a stronger direction towards plant-based or plant-rich diets instead of still promoting carbon-heavy foods of animal origin? The urgency of the climate emergency challenges our positions. How would you respond to that?
Yeah, great question. And I think, as I presented, that really these major challenges that we're facing around climate change and biodiversity loss, for example, necessitate food system transformation. We can't look at business as usual. And within that, there's no kind of justification for trying to maintain current dietary patterns, and certainly no ability to do that within the sort of option spaces to actually meet the climate goals and the biodiversity goals. And that example that I gave there about the additional requirements to remove CO2 from the atmosphere really kind of just amplify this even more in terms of how important food system transformation is. And we really do need to focus on that transformation aspect. So we're really not talking about tweaks around the edges. We are really talking about whole system shifts and in a very transformative way across all sectors, not just the food system.
Thank you. And final question in this round. So this is to Amanda. You're talking about environmental sustainability, but what about the other dimensions of sustainability, economic and social sustainability?
Yeah, thanks. Great question. So these are huge, and there are these multiple dimensions of sustainability. And when I do go out and talk with stakeholders, it's often not the health and environmental concerns that come up first. It's often how this is going to impact their livelihood or their life or their wallet and so forth. So I think if we are talking about action and impact, then we clearly do have to tackle all of these forms of sustainability. At the same time, we have to realize that this is a massive, massive task. And so it does also warrant taking it one bite of the elephant at a time and tackling, now that we have health and now we're including environmental sustainability, and we do need to expand that on. But practically, I can see why it's limiting that we can't just do all of those at the same time. But absolutely, those are incredibly important dimensions of sustainability to address.
Thanks, Amanda. So now I'd like to have a look at the Menti results. First of all, we're going to take it one at a time. I'll come back to the second question later on. But we wanted to know where you're coming from and which region, which country you are representing. So if I could just have those results coming up, then we can have a look together and see where everyone is from. So we have good representation from the Nordic region, but also outside. I can see the UK, Switzerland, Estonia, for example, South Africa. It's very small on my screen, unfortunately, but you can all see it on yours. So very interesting that we are an international group here. And thanks again for responding to the Menti. Now, I want to build on what we've learned from our previous speakers. As you've heard, the Nordic nutrition recommendations serve as the basis of national dietary guidelines. This, in essence, is the Nordic model, a joint scientific evidence base with various ways of implementation. So what's happening, for example, in Denmark, in Sweden, and in Finland? How are the recommendations being implemented in practice? I'd like to welcome our first speaker in this section of the program, Dr. Annica Sohlström, who is the Director General of the National Food Agency of Sweden. And I'm going to hand over to her to explain what's happening, some of the things that are happening in Sweden. Annica, the floor is yours.
Thank you very much, Helen. Can I have my first slide, please? Yeah, thank you. So good afternoon, everyone. I will tell you about the keyhole label today as an example of implementing science into a practical tool to guide consumers to healthy diets, but also for food companies in their product development. Next slide, please. So the keyhole is a voluntary front of pack nutrition label, which indicates a healthier choice within a certain food category. It could be, for example, breakfast cereals, bread, dairy products, ready meals. And in Sweden, we have used this symbol for more than 30 years now. And in 2009, Denmark and Norway decided to introduce the keyhole on food products. Next slide, please. And next slide. So who is behind the keyhole? Next slide, please. The keyhole is really an example of a successful Nordic collaboration between the national food agencies in the Nordic countries. Maintaining consumer interest and appreciation in a label, as well as staying up to date with the scientific progress, is very time-consuming. And in the Nordic Working Group, all countries are small, but by sharing the work between us 4 Nordic countries, the keyhole actually remains one of the most known front-of-pack labels globally. So we all benefit from sharing the workload, as well as the positive experiences, of course, by working together. And in practice, we have 2 working groups, one focusing on communication, and the other is a more scientific group, ensuring that the criteria for the keyhole are updated according to progress in science. And therefore, we are carefully now following the revision of the Nordic nutrition recommendations. And the keyhole is also found in Lithuania and Macedonia, but those countries are not involved in the working group that we have. So next slide, please. Next slide. The Nordic nutrition recommendations are the scientific basis for the keyhole. And having this common scientific basis is a prerequisite for the successful development of the label. We couldn't have the keyhole without the new Nordic nutrition recommendations, I would say. The Swedish food-based dietary guidelines indicate the most important changes for a healthier diet and are used as guidelines for setting the conditions for the keyholes. And you can see our quick food-based dietary guidelines here as green, yellow, and red. And the keyhole have different criteria and thresholds for less and healthier fat, less sugar, less salt, more dietary fiber, more whole grain, more fruits and berries and vegetables and pulses. And besides those conditions, there are also some general conditions, like, for example, no sweeteners are allowed, and also threshold for trans fatty acids, which is even tougher than the EU regulation. Next slide, please. The keyhole is not only in line with the food-based dietary guidelines in the Nordic countries. We sometimes call it a summary of the food-based dietary guidelines. By using the keyhole when you buy food, you actually get all the food-based dietary guideline in one symbol, which makes it very easy for the consumers. Next slide, please. No, this is not my... Should be one. Yeah, there it is. Thank you. Building consumer knowledge and trust takes time and resources. And we have worked together on this now for more than 10 years. And today there is a high consumer knowledge about the keyhole. More than 95% of the Swedish population know the keyhole. And actually more than 60% claim they use the label to make healthier choices in food shops. The keyhole is also well integrated in primary health care, where more than 50% of medical doctors, nurses, and dietitians claim they use the keyhole as a tool for inspiring to more healthy diets in communication with patients. And having the label as part of the education is one of many important contributions to increased health literacy and improve equality in health. And therefore, we are very happy to see that nearly 3 out of 4 teachers claim they use the label in their work in schools in the Nordic countries. Next slide, please. Finally, I would like to mention some key messages that we have learned from the Nordic collaboration on the keyhole. As I said before, a common scientific basis is a prerequisite for the efficient collaboration that we have and also for setting common goals. Also, that we have interdisciplinary working group is a prerequisite for efficient collaboration and for reaching the goals. And also that we have created a very good working culture with focus on finding common solutions and focus on the effects of our work rather than having national agendas. is a very good thing. And finally, rotating responsibility and sharing being chair of the work increases participation and shares the workload. I think next slide is the last one. Yes, thank you very much. Over to you, Afton.
Thank you very much, Annica. Really important insights. And now we're going to change country. We're going to move a bit further south to Denmark. Denmark is a country that has been very busy lately updating their national dietary guidelines. And to tell us more about this, we're joined by Pøhl Enevoldsen, and she's the head of unit at the National Food Agency of Denmark. I'm going to hand the floor over to you, Anna.
Thank you very much, Afton, and thank you for the invitation to all of you. Can I have the next slide, please? In Denmark, we've taken the first steps towards a more healthy and sustainable diet. We launched our new food-based dietary guidelines in January, and we sort of started out with one of the corners in sustainability. So it's important for me to say that we haven't embraced all aspects of sustainability, but we sort of started out with one of the corners, the climate. Today, I'll share some of our work and the challenges we've had on the way, which I hope can be of some value to others who might be in the similar or in the considerations of starting a process like ours. Next slide, please. Our work was based on a scientific evidence report, Guidance for Sustainable Healthy Diets from the National Food Institute from February 2020. The report included the Eat Lancet diet and sort of customized it for the Danish food culture. In addition, the evidence report behind the previous dietary guidelines was also included as background material, as well as the Nordic nutrition recommendations. And of course, we are looking very much forward to having the new Nordic recommendations in 2022 to see if that affects our guidelines in several ways. Next slide, please. The development process has involved a lot of stakeholders, including different ministries, Danish health authorities, for example. It's included the National Food Institute, consumer organizations, non-governmental organizations, as well as the food and retail industry, and of course, organizations within climate and sustainability. We have also done some pre-tests among consumers to ensure that they can understand what we are trying to communicate to them. So that has also been an important part of our process. Next slide, please. And here you see the guidelines. We have 7 of them, and I'll just read them out loudly. The first one is eat plant-rich, varied, and not too much. Number 2, eat more vegetables and fruit. Number 3, eat less meat, choose legumes and fish. Number 4, eat whole grain and foods. Number 5, choose vegetable oils and low-fat dairy products. Number 6, eat less sweet, salty, and fatty foods. And number 7, if thirsty, drink water. Next slide, please. It is important for us to stress that a lot of the guidelines are actually almost the same as earlier. Vegetables, water, whole grain foods, fish, and fruits are still very important choices when it comes to both climate and health. But of course, the climate focus has forced us to rethink our guidelines, and let me highlight some of the changes. We went from 10 to 7 guidelines in order to make it less complicated for the consumers. We really focused and went from talking about nutrients, for example, fatty acids and sugar, to talk about foods instead, because we believe that that'll make it easier for the consumer to actually use our guidelines. We have, as new things, mentioned plant-rich. We advise to eat less meat, and we advise to choose legumes instead. And if we go into some of the details, we've, for example, made a drastic cut down on all kinds of meat to 350 grams a week, and we advise to eat 100 grams of legumes a day. And that's a great shift, since the consumers eat, for example, in average 5 grams of legumes a day. So we really have a huge challenge here. Next slide, please. This might sound easy to use since we've had the evidence and we've tested along the way, but it has not at all been a walk in the park. We have faced a lot of challenges on our way, and I'll just share some of them with you. We have, of course, had some, I wouldn't say troubles, but it has been challenges us to incorporate climate. It has been very new in our guidelines, and we've had to do that without compromising the health aspects. That's, of course, we've had a lot of discussion on how to ensure the intake of, for example, protein when we were lowering meat intake, how to ensure the intake of calcium when lowering the intake of dairy products, and so on. We've also faced a challenge when we had to tackle the gap between our food culture at the time and what we recommend for a healthy and climate-friendly diet. This is in particularly relevant when it comes to our advice on eating less meat, as I said earlier. And another challenge is that we still need better data of the climate footprint from our foods in order to gather all our stakeholders on this important issue. We see food companies are challenged regarding their possibilities of making claims, and we see municipalities who wants to claim the reduced carbon dioxide, etc. So that's a challenge at the moment. And in this process, it has been very crucial for us to involve stakeholders. And of course, it's also a challenge to balance this involvement of stakeholders. We think it's crucial to ensure the implementation afterwards of the dietary guidelines, for example, in order to achieve structural and behavioral changes. So we've had a lot of valuable discussions on how to formulate and communicate these new guidelines with our stakeholders. But it's also important for us to stress that we have not been discussing the scientific evidence. It is what it is, so to speak. So, and our experience is that our stakeholders understand that, and they contribute still, though they might not agree on all of it, but it has been very, very valuable for us. And last but not least, we're of course facing this huge challenge on how to implement our food-based dietary guidelines to all consumers, and not only the well-educated. And I think we have had a lot of work to do there. Next slide, please. Yes, that's it for now for me. I think you moved on to the next speaker, but thank you for now.
Thank you very much, Anna. And as you've said, there's a lot of challenges that lie in the way, but at the same time, you know, you're starting somewhere. And thank you very much for also kind of being open and honest about these different challenges that have been that you're confronting right now. So now on to our final speaker in this portion of the program. We have Marjaana Manninen, and she's a counselor of education at the National Agency for Education in Finland. And she's joining us today to speak about Finland's approach to school meals and how this connects to changing eating habits. Marjaana, over to you.
Thank you, Afton. And hello, everybody. It's great to be here today. So, the concept of well-being and sustainability has a broad meaning in Finnish education. The school plays an important role in promoting the food system by pupils' well-being, health, and learning. Our aim is to ensure the well-being of the entire school community by food-related education. Next slide, please. So the well-being has a positive impact on learning outcomes. The school culture takes care of the safety and well-being of each and every member of the learning community. The curriculum describes the objectives for education in health, nutrition, sustainability, and manners. Next slide, please. For 7 years ago, it was necessary to change the curriculum in Finland. We have done some smaller changes also after the large updating in basic education. The purpose was to develop schools to meet the requirements of the society today and of the future. The drive for change arose especially from the need for increase the motivation of learning, improve school satisfaction and well-being, of course. One key goal was to enhance pupil participation, increase the meaningfulness of learning, and make possible for every pupil to experience success. Particular aim was to develop the learning environments and work methods used in schools. A learning environment must be safe and inspire learning. So environments outside as well as inside school should be used more. So we think that school canteen works as a learning environment as well as the classroom. Next slide, please. Finland is using schools to improve the health of their pupils. National policies require that schools provide obligatory health education classes, physical education, and nutrition and cooking lessons in home economics classes. Also, healthy and free school meals play an important role in promoting health and well-being, as well as sustainability. Finland has also issued recommendations that schools reduce pupils' access to sugary, high-fat snacks and drinks, as well as on how foods should be marketed to children. Municipalities are required to ensure that each school provides free annual health examinations for all pupils and give personalized advice on mental health, healthy eating, and physical fitness. And through these services, school nurses are able to monitor the health of the child and the well-being of the entire family. As a result of those efforts, the increase in childhood obesity has started to stabilize across the country. And next slide, please. Two of the most important factors contributing to eating habits and well-being at school are cooking lessons at home economics and school meals with food-related education. So the food functions as a pedagogical tool for teaching sustainability, good nutrition, and eating habits. The next slide, please. Basic education is structured around units consisting of grades 1 to 2, 3 to 6, and 7 to 9, all of which utilize different working methods. The choice of method depends, for example, on the skills of different age groups. The aim is to develop the pupil's food sense. That way, the pupil's motivation to learn lasts throughout their lifespan and their knowledge gradually accumulates. The themes which are illustrated in this picture carry pedagogical questions: what, getting to know the topic how, and then how, training of activities, and then why, with contextual understanding. And the next slide, please. In Finland, home economics is a compulsory school subject for all pupils. Home economics education includes both theory and practice. For example, pupils learn the basic skills of cooking, everyday life skills, and skills which are needed for successful group work. The objective of home economics is to develop the knowledge, skills, attitudes, and readiness required to master everyday life and to adopt a sustainable way of living that promotes well-being. And next slide, please. The Basic Education Act in Finland states that pupils who are attending school must be provided with a properly organized and supervised balanced meal free of charge every school day. So the free school meal is for everybody in every school day. Next slide, please. So the school meals are an integral part of national core curriculum and schools' pupil welfare services. The municipalities have their local curriculum, which also describes the objectives for education in health, nutrition, and table manners during the school meal. And the next slide, please. The national recommendations for school meals provide guidelines for the school catering for the well-balanced lunch and healthy snacks. Next slide, please. And food education that promotes participation also develops joy to both eating and learning. The health-related and social role of school meals are taken into account when arranging school meals and snacks. And the next slide, please. So, learning about well-being and sustainability is a lifelong process that starts in early childhood. The period of basic education is important for children and young people, as it is the time of both rapid physical and psychological development from a child into a young adult, as well as the time that pupils gradually become more aware of the choices they make by themselves, as well as the basis for making those choices. So, school meals are important to children and youth's well-being, their ability to learn, and to their healthy growth and development. So, school meals are an investment into the future as well as food education. Healthy school lunches can reduce childhood obesity and diabetes. Thank you very much.
Thank you, Marjaana, for your presentation, and thank you so much to Annica and Anna as well for bringing the different perspectives from your countries. So I think we're going to move on to the question part where we've collected the different questions that have come in for you. But while we're just bringing in those questions, I'd just like to remind everyone that this webinar is going to be streamed and available on YouTube. So if you want to kind of review it afterwards or send it to your colleagues, please do so. We'll make sure that the link is sent around to you and that you have the ability to access it. It's just one of the questions that was reoccurring in the question and answer box. So now I'm going to move to the questions that came in for Annica and for Marjaana. So we'll just do it in the same way as before in the round, just ensuring that everyone gets a chance to answer a question. And we'll just keep going until we run out of time for this part of the session. So I'm going to start with you, Annica. So someone is saying, thank you very much for your presentation. Today, the keyhole criteria are built on nutrient values. In the beginning of the webinar, Amanda Wood mentioned the keyhole as a tool to implement the food-based dietary guidelines. Is the Swedish Health Agency, perhaps it's also what this person means is the Swedish Food Agency, your agency, are you considering the possibility to incorporate environmental sustainability into future criteria?
I think that would be perfect if we could, but it's already quite complicated to handle the keyhole with just the health aspects along with the Nordic nutrition recommendations. So I'm not sure it would be possible to also include sustainability in the keyhole and get a good label. But we will see now when we have the new Nordic nutrition recommendations if that would be possible. But so far I think we have struggled enough just to keep updated with all the nutrition recommendations. So we will see in the future, but I know that it is something that consumers would like us to do, to have one symbol that covers everything. But it's quite complicated.
Thank you. Anna, this is a question to you. How did the process of creating such national guidelines look like, particularly when you were considering cultural sustainability? And how was that included, if it was included?
Can you ask that again? Cultural sustainability?
Yeah, so it's kind of to me, it's a bit of a two-part question. So I'll break it up into two parts for you. How did the process of creating the national dietary guidelines, what did it look like? How did you go about that? And then the second question is that, it was cultural sustainability included, and how did you do that?
Okay, I'll try to answer that. The process, I'll just give you a brief one that looks a lot more simple than it actually was. We had the evidence from the National Food Institute, and then we sort of created the first draft. And this draft we tested among consumers, and we had our first workshop together with all of our stakeholders at one time. And at the workshop, our stakeholders were, we wanted them to tell us, what do you think about these guidelines? What do you think the way we've listed them up and the way we communicate them? And to be honest, they didn't like it at all, and neither did the consumers. So we actually had to do a whole new round, not on the evidence, because we knew what we would communicate and what the guidelines would look like in the essence, but we didn't know how to communicate it. And then we made another draft. And when I say another draft, I mean we made a draft number 20, because we have had a lot of drafts, because we've had a lot of discussions on how to communicate these guidelines so they would be best understood and used out there. And then we invited all our stakeholders again. And I forgot, after the first workshops, all the stakeholders were invited to a hearing where they can send all their comments for us. So we both had the workshop and we also had their comments. So that was quite a lot. They had a lot of opinions about our first draft. And then we presented the second draft, and that was obviously much better. They liked it more. And I would also say that this process has helped us a lot. We had a lot of very valuable comments from our stakeholders. And after the second draft, we of course made another draft, but not, we didn't change that much in the third draft. And we tested the campaign and how the consumers understood our campaign. And then we launched. But before we launched, we made a toolbox for all our stakeholders, and they had access to this toolbox already in November, and we were launching in January. And why I'm telling you this is that we had a lot of confidence between us and our stakeholders, because they were actually able to keep the guidelines within. So I think that we all went out there in January, all the retailers, the food companies, the non-governmental organizations, they were all with us when we launched. And I think a big thanks to them, because that made it possible to come out really wide. And the second question again, you're talking about food culture?
Yeah, so it was framed as cultural sustainability.
Yeah.
But, it's also, as you said, is food culture. How do you take that into account?
Well, the National Food Institute did a lot of that when they were doing their evidence or bringing it to life. But we have also taken some chances, because eating legumes is not a part of Danish food culture. But in our opinion, we have to move in that direction if we really want to have a more sustainable diet. So that's sort of a choice we made, that we in many ways stick with the Danish food culture, but we also need to take some steps in order to change the diet. And that's part of it. And if you talk about social culture as well, that I think that might mean something about what I said at the end, that we need to also get all those not well-educated with us on this travel, on this journey. And it's a huge challenge, and we haven't really found the path yet. but we have some tools that we can use, and one of the tools is, in my opinion, public-private partnerships, and maybe we'll talk a bit about that later.
Thank you. Yes, there is a question that is linked to that, but we'll get to that in a bit. Marjaana, a question for you. Should schools have their own gardens to produce their own vegetables, as it would both teach agriculture and the importance of local production? Maybe you could say something about that.
Thank you, Afton. Thank you. Very interesting and good question. That's one of those methods the schools may use. It's not possible in big cities, in a bigger schools, in large level, but in some levels it's possible. It's one choice of methods, I think.
Great, thank you. And a question, this is for everyone now, just opening it up to whoever would like to answer. So the question is, and this has come up also in the other session, but we didn't have the chance to get to it, but how do we address the extraordinary political or lobbying power of the meat and dairy industries when it comes to dietary guidelines? Anyone willing to answer that question?
Could you please repeat?
Yeah, so it's one of the question is, how do we address the political power, the lobbying power of the meat and dairy industry when it comes to dietary guidelines? So it's a reoccurring question that we've seen in the Q&A. If no one feels
Rune wants to answer.
Yeah.
Okay, I can try to respond to that question. Is that okay?
No problem, Rune. Yeah. It was also coming up before in your session too. No problem.
Yeah, I can tell you how we try to handle this in the NNR committee. We really encourage input from all stakeholders, including industry and all sorts of stakeholders. And but we would like to do it open and transparently. So when we have any contact from stakeholders, we route them to our official website so that everybody can see the input, and we try to respond to all inputs so that everybody can also see our response. So I think openness and transparency is key, and we would like really to have input and engagement from all possible parties.
Thank you, Rune. That's great. And again, that was asked, I believe, to in your panel beforehand. So it's good that we could answer that question. Annica, I have another question for you. The keyhole is only put on food that meets certain criteria. What do you think about implementing simplified front of pack nutrition labeling on all food products that, as it is done in several European countries, in order to help consumers to understand the nutrition value of all foods?
I think that's another system, like having traffic lights and so on. And I think because the keyhole is like a positive labeling, it shows what is good to eat, but it doesn't show what is not good for you to eat. But if you have like traffic lights, you also show the red lights. And I think if we would have such a labeling system, it needs to be compulsory, because otherwise it wouldn't be used, I think, by the food industry. So I'm not negative about it, but it's another system and it needs to be compulsory in that case, I think.
Great, thank you. And a question for you. The bioavailability of several nutrients differ significantly in animal and plant-based foods. In the new Danish food-based dietary guidelines regarding the increased recommendation for legumes, what does the risk assessment regarding the bioavailability of critical minerals such as iron and selenium in legumes conclude?
Oh, that's a very detailed question for you right at the moment, but we've looked very carefully into the evidence from the National Food Institute. And of course, those nutrients are some of the answers of why we do not in total say don't eat any meat. Meat is a part of the Danish food culture, and it also brings a lot of important nutrients for us. And that's why we've tried to balance between legumes and meat, because meat is a good source for some of these nutrients. I think that's the shortest way to answer this question.
Thanks, Anna. And the final question in this round is going to go to Marjaana. And the question goes as such. What is your opinion for overcoming the threshold between school and home? Children, and especially younger children, are all about learning and are highly ambitious. I think about them as teaching their parents to create healthier food patterns as a whole. And the parents need to get on board as well, and not basically being able to provide the meals that their children are learning about in school. So how do you connect these two worlds?
By the children, I think schools can cooperate with the families and the homes, and in Finland, school have to cooperate with the families as well. So, and I believe in lifelong learning. So we can also educate later. So you are never you never know too much, and you never have to so much skills you need. So you don't have to end the school education after basic education. So I believe in lifelong learning, and there could be different education for adults as well.
Thank you very much. So I'm going to close this part of our webinar for now, and I'm going to shift to Dr. Kremlin Wickramasinghe. And basically, before I do that, thank you so much to Annica and Anna and Marjaana for your contributions. We'll come back to you later, so hold tight. But now, as I said, to our next guest, Dr. Kremlin Wickramasinghe, and he's the acting head of the WHO European Office for Prevention and Control of Non-Communicable Diseases. And Kremlin is going to help us out in kind of zooming out beyond the Nordic region and really putting what you've heard so far into a broader context. So I'm going to hand over to you, Kremlin.
Thank you, Afton. I hope you can hear me, and thank you for that question. And it's great to join this great panel about this important topic. So greetings from the World Health Organization Regional Office for Europe. We are always delighted to join these very progressive advanced discussions happening in the Nordic region, but also to share the lessons from other part of our region, and also to take your learnings to advance our global agenda. So as Afton mentioned, the promotion of healthy and sustainable diets is becoming more and more a priority topic for many member states in our region. So in WHO European region, we work with 53 member states, EU member states, some former Soviet Union countries, CIS countries, Central Asian countries, Balkans. So it's a very diverse range of countries. Of course, for some of them, this is a more priority than the others. But we are learning that sometimes prime ministers are more attractive to the climate change agenda than the nutrition agenda. And so health ministries, health colleagues find that joining these two will give us win-win situation to advance our nutrition policies as well. And with the evidence base becoming ever more enhanced, connected between the climate change, planetary health, and nutrition, I think we can keep more solid steps, step by step. WHO has always been very careful developing guidelines. We always wait for more evidence to come to make sure that we take those steps carefully. So I think now we have more and more evidence coming, so we can work with countries and provide guidance. But at the same time, we have had many conversations from our office with our member states. What are the barriers to really accelerate? And I think many countries, they recognize the topic, they understand this is important, but they lack capacity at national level to really take action and implement policies. So it is not lack of acceptance, but it's just really the lack of technical capacity to implement some of those recommendations coming from researchers and new evidence. So I think it's good that Nordic nutrition recommendation is an important achievement. I know Nordic countries have been always pushing this agenda ahead, and it helps us as organization to move forward with expertise, with your experience, to bring stakeholders together and spread the word and move this agenda forward. So we are also building capacity within countries to address some of those challenges. For example, we are building a toolkit to support countries to promote sustainable healthy diets. One of them is an open source model that countries can use to model their new dietary scenarios, their new dietary recommendations, to look at the impact on environment and health outcomes, which will be able to help them to push some of the policy priorities or show the policymakers' impact. So far, these kind of exercises have been very expensive academic pieces, only affordable for countries who could afford them, and taking years. But I think we are now synthesizing this knowledge of modeling to one place and offering a free tool with a manual to member states. We are also working with stakeholders to work on healthy and sustainable food procurement policies, especially within EU context, how to navigate that legal landscape. And also about the other interesting things such as digital environments, how we can use the digital landscape to promote that. And more importantly, talking to member states to create a network of member states. I'm coming to this meeting from a 30 member states network talking about how to reduce salt. That is a network that has been running for more than 15 years in the European region, chaired by Switzerland. So we have very good examples how countries coming together, discuss their issues and find a solution. So similarly, I think it's time now for WHOs to formally establish a network. We have the request from many countries and we really look forward to working with them. So moving forward, I think bilateral and multilateral collaboration is going to be very important. And the Nordic region is a fantastic example and a collaborator in this process. So I really look forward to working with all stakeholders and making this movement stronger in our region. Thank you, Afton, and thank you. Happy to answer any questions.
Thank you, Kremlin. And we will get to also the reflection period where we'll all have a chance to basically reflect on some of the important questions that I'll pose to you. But for now, I would just like to have a look at what's coming in from the second question, that we asked on the Menti. I'd like to see what kind of responses we got. And let's see here, just enlarge in my screen so that I can see it as well. So, as you can see, we asked basically, what is your number one piece of advice for changing eating habits? We have a lot of different responses coming in, and you can please continue to add those, but I'll just let you read those, give you a little bit of time to read some of them that are coming through while we shift towards our next part of the program. And so everything that we've heard and discussed today really indicates that action needs to be taken if we are to move beyond just writing guidelines and developing guidelines, but to actually transforming what people are eating. And so in this final section of the program, I have some specific questions for our speakers. And what I've done is I've kind of put them into groups just so that we have some variation in the questions and also really get to the heart of the expertise that the different speakers have in our webinar today. So what I'm going to do, I'm going to start with Rune and Helen and Amanda and also Kremlin, and we'll do around there. And I would like you to answer this question. So the question is, what is your most important piece of advice for how we can move from guidelines to action. And I'm going to start with you, Rune.
Okay, thank you. It's a tough question, but I think there is a lot to build on from the Nordic model. In the Nordic countries, we have a tradition where health authorities listen to science advice. I believe this is especially important when it comes to sustainable and healthy diet. More than in any other area, the politician, authorities, the industry and public should build on science advice, not from single papers or reports, single scientists or experts, but from the best available systematic synthesis of scientific literature. So these issues are far too complex for individuals to comprehend or synthesize themselves. It is the systematic literature reviews, such as, for example, the IPCC report and the NNR report that we develop, and equivalent reports that should form the basis for action. All of us need to act based on the best available scientific evidence. We will also most likely face a lot of dilemmas when we formulate food guidelines and when we should move from guidelines to actions. So we need to balance all these dilemmas. It is really important to emphasize openness and transparency, to build confidence and trust, and to develop a uniform message. There are so many good initiatives from a range of stakeholders, and there will probably come many, many more. So I think it is really important to coordinate these actions to educate our citizens the best we can. So I think coordination is central. It is not time for partisanship. The situation calls for uniform, bold action by the politicians, the authorities, and the industry and other stakeholders, based on best available scientific evidence. So I think the way we handle this critical situation is really central. I think you can perhaps say that it's a test of our democratic societies, but it is also a huge opportunity for nutrition and sustainability scientists to contribute to the society. And we can easily lose public trust and confidence. So that, I think, is the reason why we should be transparent and deeply rooted in the best available systematic synthesis of scientific evidence. And that is exactly what we try to foster or promote in the NNR 2022 project.
Thank you, Rune. Yes, thank you. Helen, same question to you. Most important piece of advice for how we can move from guidelines to action.
Yeah, thank you. Really good question. And there's probably a ton of different ways to answer that actually, but I'll focus on one example where I've done some work previously. So this may not be the most important in terms of overall impact, in terms of places to start, but it does seem like one of the most promising places to begin implementation, and that's the food service sector, which of course is just one subsector in the overall system, but I think a very important one, and possibly increasingly important going forward if people seek more convenience, for example, in how they eat. And I think really the key thing is to support where there's already momentum. So in my previous work, I've seen that there is a lot of interest and momentum already happening in the food service sector in terms of trying to reduce environmental impacts and implement more kind of healthy and sustainable meal options. And if we think about, for example, food service in university settings, then there's also opportunities to engage kind of active and progressive civil society groups, such as youth groups, in that as well, to really help to kind of build that momentum. And I think obviously given sort of the changes here, really give consumers the chance as well to actually experience different foods and different meal options. And in terms of support, I think really that could include helping institutes with targets and sort of pathways to implementation and monitoring, and actually having reward schemes as well. So I think really, obviously it's important kind of longer term to alter other aspects of the food system as changes in the food sector, the food service sector occur, to avoid basically running into supply issues, for example. But I think that's really, yeah, that's the key one that I would point out as a starting place.
Thanks, Helen. A nice compliment, also something different, new food for thought. Amanda, what are your thoughts on this question?
Yeah, thanks, Afton. There are obviously a lot of things that could be said here, but I'll just touch on two related points that I think are only really going to echo what Rune and Helen have been saying. But first, I think if we really want to see this action on the scale needed to shift diets of really large parts of the population, then there really is not going to be a silver bullet solution or just one place where we need to focus our investment. So sure, if we wanted to, for example, use regulation as our only tool, then that could get us a lot of action. But given that that's not really the desired path forward, it's going to be that package of complementary solutions that's important to think about. And that, of course, will be different depending on your specific context. But second, and related to that, and really echoing what the two previous speakers have said, I think it'll be important to harness this kind of existing infrastructure and initiatives and interest in the sustainable food system space. You know, here in the Nordics, but also as elsewhere, so much has been happening in this space. And to really have impact, we need to find those change makers, those decision makers, those innovators across the system and see how we can inject basically the guidelines into their existing work. So we really need to get the guidelines in the hands and the minds of those who are actively shaping our food systems.
Thanks, Amanda. Kremlin, same question to you. How do we actually take all this great advice and these guidelines and actually make sure that they're being implemented? What is your advice?
Thank you, Afton. Not on this guideline. I think in our day-to-day job, what we are trying to do is globally WHO develop guidelines on salt, on sugar, on physical activity, and a regional office, our day-to-day job is supporting countries to implement those guidelines. So not just from sustainable healthy diets perspective, but with our years of experience of supporting countries to implement guidelines with some successes and with some less successes, we understand that one of the major barriers is the lack of capacity at government departments for us from our side. Our main counterpart is government. So I'm mostly talking to you from my experience, what I hear from governments. May not be the same for Nordic countries, but in most countries, there's one or two people working on the topic, covering everything. When it's such a multi-sectoral, multi-dimensional issue, they really don't have the capacity to draft policies, the legal support, the technical support, monitoring, data, access to data, or all those issues. So what we have been able to do, at least first step, is bringing countries together and they learn what kind of capacity should we have in my institution, in my department to move this forward. They might learn it from a country who has kept those steps ahead. For example, yesterday we were talking about how to handle misinformation related to nutrition. And then countries such as Belgium and Portugal said what kind of staff they took to the team to tackle nutrition-related misinformation. What kind of terms of reference do you need to recruit a person like that with those skills? Sometimes more computer skills, sometimes more designing skills. And this is not the bread and butter of the nutrition or public health experts to recruit that to your team. So for us, it's the network, bringing countries together, really understand how they build the capacity, but in more detailed level, and then training them and provide continuous support and networking step by step to go forward. Thank you.
Thanks a lot, Kremlin. And okay, thank you very much to this cluster because you've provided some very interesting reflections on that question, really about bringing things into implementation. Now I want to shift to the other cluster, and that cluster is Annica, Anna and Marjaana, who are representing their national governments. And the question for the three of you is, what is your most important piece of advice for policymakers who are trying to shift dietary patterns to become healthier and more environmentally sustainable? So based on your wealth of experience, what would you recommend? And I'm going to start with Annica.
Thank you. I think this will be a little bit in line with what we have already heard, but I have 5 concrete advice, I think, to policymakers. And the first one is base your measures on science and evidence, both regarding what is healthy and sustainable to eat, but also when it comes to what measures you provide or introduce in the society. What evidence do we have for them that they have effects, especially for different socioeconomic groups? The second one is that this is a long-term work. It can't be solved with short-term limited projects or campaigns. It has to be long-term. We have to focus on changing the food environment, especially the food environment around children. And so we make the sustainable consumption the easiest consumption. And also the fact that information and education is necessary and it is important as a base, but it will not change eating habits. I think we have to understand that and accept that. And finally, use all tools there is in the toolbox and don't be afraid of regulatory measures. Those are my 5 advice.
Thank you very much. It's hard to choose the most important one, and yeah, thanks for coming with 5. I think
there is no silver bullet.
Exactly. You found a way around my question. Very good. Anna, over to you. Your advice for policy.
Yeah, thank you. I think I'll just move on from where Annica left it, because I think we have to acknowledge that we can't leave it up to the consumers alone. There are way too many aspects affecting what we're eating. It's not only a choice, it's also about habits, it's about social culture, food culture, economy, and knowledge. And we really have to be aware of that when we want to change the eating habits. One way I think that we can make our way through is by building public-private partnerships that is built on scientific-based food-based dietary guidelines. That's very important to stress, that's what we build these partnerships on. And I think that if a partnership has to be successful, and let me also stress that this is not a silver bullet, but it's just one way of working with more structural changes where we don't leave it up to the consumers, but with partnerships where we have clear, ambitious, but also achievable goals that depends on all partners. I think we will be able to move forward if we work together on different aspects of the food-based dietary guidelines, and we work together from different sectors, because that's what we really need if we want to shift our dietary habits.
Thank you, Anna. Marjaana, last but not least, your advice.
Thank you. I think you should focus on everyday life and lifelong learning, because often repetitive small or little things have a big impact. And then the choice of methods depends, for example, on the age or skills or motivation of different age groups. So give choices, don't try to force only. And then remember that sustainable lifestyle is a lifelong process that starts in early childhood. The period of early childhood and basic education is important for children and young people, and that's why you have to give good resources. And then a good aim is to develop the food sense of all citizens. The one's motivation to learn lasts throughout their lifespan, and their knowledge gradually accumulates. So remember the lifelong learning. Thank you.
Thank you, Marjaana, and thanks to everyone who has answered these questions. I know it's difficult to summarize them so quickly, but I think you did a fantastic job. So now I'd like to move to the conclusions of this webinar so that we ensure we close in time for you all to move on to your next activities. So just let the little conclusion slide run there. Conclusions, yes. So we've had some very rich discussions over the past 2 hours, and I wanted to kind of summarize things for us. So three points, I think. If we want to change our diets and we want to change the diets of our fellow citizens, we'll need to actually collaborate. I think collaboration has come up again and again throughout the past 2 hours. Now, Nordic collaboration on the nutrition recommendations and dietary guidelines is a partnership of consensus and diverse implementation models. So I think that's a really important takeaway message for everyone listening here today. The second thing is that we need to move from recommendations and guidelines into transformation. So while these tools are extremely important because they basically set the foundation and we can refer to them, it's not to disregard them, but to now look towards the implementation and what we can do. And in order to do this and to aid this transformation that we wish to see, we'll have to find new and creative approaches. And at the same time, I think we can also celebrate, because when we look at the implementation and what's happening right now in the Nordic region, we can see that there's already things that are happening. We saw great examples of that. We have the keyhole, we have school meals, we've been talking about also in public canteens, public offices. So things are happening and we have to acknowledge that. Finally, I've also heard some interesting keywords that I wanted to share with you. It's about balancing the dilemmas. It's about openness, transparency, uniform messages, coordination, bold actions, public trust, ambition, reward schemes, lifelong learning, harnessing existing infrastructure, capacity building, long-termism, culture, public-private partnerships. So we've come to the end of this webinar, and I think it's been really, really interesting to hear from all of the speakers, and I hope that everyone who's tuned in can also agree with me. So on behalf of the Nordic Council of Ministers, I would like to thank everyone for taking the time, because 2 hours is a pretty big chunk of your day. And you can rewatch any part of this webinar on the Facebook channel, but also on the YouTube channel of the Nordic Council of Ministers. And last but not least, I also want to thank our speakers again, and to everyone who is working behind the scenes to make sure that this webinar has functioned and that we could actually finish a little bit ahead of schedule. Imagine that. So I'd like to sign off for now and say take care, everyone, and please take all this information that you have received today, reflect on it, and start implementing. Thank you very much.